Hello and welcome. My name is Will Falk and I lead PwC's healthcare practice in Canada. I'm joined today by Dr. Ed Brown. Ed is the CEO of Ontario Telemedicine Network, OTN. So Ed, take a moment and just give us your definition for virtual care.
Sure. Virtual care to me is really the concept of integrating collaboration tools, data sharing tools, remote monitoring tools, so all the tools we would use in the field of telemedicine into a healthcare setting, into a healthcare system to create really a holistic approach to collaboration across the system. So that's a bit of an academic definition, but really it's about being able to deliver care with communications tools. That's what it is. And I think the reason that's become terribly important for us, I think, is because of some of the ways that we're really moving our healthcare system. So here in Canada, we were a pioneer, I think, in the 60s, developing a Medicare system. What that was about, of course, was acute care. If you got sick, you had somebody, a government willing to pay the doctor. You had all your hospital costs covered. That was brilliant. And so we're still very good at that. We're very good at acute care. The problem is the world shifted, and now the challenges we have are about chronic care. People are living longer, and they're living in the community, and our job is to keep them healthier and to try to keep them out of the hospital. And we haven't been that good at that yet because we have many organizations out there, many different providers who are all doing a great job. They're all heroes in their space, in their field, but we don't have that collaboration. We don't have the ability to have those folks working as a team together as effectively as I think we need to get to. And of course, what you need to do that are processes and tools that enable these folks to work together. So we think these technologies are, a huge part of that. If you can, use video conferencing to bring a team together to see the patient in their home, that's fantastic. If you can share data, if you can build a care plan together, if you can tell each other when the patient's admitted to hospital and not going to be home, just all the simple things that you need to do to really support these patients, I think we're going to be way ahead.
When am I going to be able to email with my son's pediatrician? And when am I going to be able to get my prescription renewed? And when am I going to be able to access these services on a regular basis virtually?
It's a long road. It is a long road, and I think over the years for us, adoption and change management is really a central part of what we do. And it kind of goes like this. When we first started out, we looked for early adopters and champions. We did whatever we had to do to get them out. We bought them cookies, whatever it took, and that kind of worked to get you started. But there's a whole set of things, and it's well known to the people in the field of change. How do you build awareness? How do you make people aware that this is happening?
Right.
And for us, it was, well, how do you access it? So how do you make these systems available to people? And then how do you really show them what the value is? Everybody has to understand why they're doing this, why they should get out of their chair, walk down the hall and actually do it. And that's a very long process because there's, very different values for different programs, different organizations, different individual providers. So really being able to share that and express that and have people buy into it is a huge part of it. The important part of what we do is trying to really improve healthcare. Improving healthcare means better care for patients, better outcomes for patients, reducing the costs and pressures on the healthcare system. So I think my goal is to make that happen here to the best of our ability to enable that as our organization can.